Hello, good morning to you, and many thanks for joining us. You're watching Galaxy. Today, coming to you from Galaxy Television. My name is Justin Akadonye.
And he's joined by Uche Onyekulije. And of course, it's Wednesday, the health edition. And of course, before we go into health, we would also be looking at what's up with Ekiti. But before that, on health, for those of you who are so interested, I started getting SMSs this morning, people asking questions. We'll be looking at healthcare for newborn babies. But before that, let's talk Ekiti, Justin.
Yes, Ekiti election, the race to it has actually gathered momentum. Today is Wednesday, so I count like barely 72 hours to the polls, and then preparations are in full gear. Plus, from reports we got yesterday, the transporters, that's the commercial motorcycles and the bus drivers, they had a bit of a running, in the state. All of that pointing to the governor, Ayodele Fayose, who doesn't know, who didn't really want the APC to campaign, according to reports. Yeah.
But why would a governor not want an opposition to campaign? This is an election. You have the right to vote for whosoever you want to vote for, and you also have the right to be voted for. So yes. I don't see why this should be a toss, but we're hoping that it's going to be a very free and fair election come Saturday.
Yes, and we are expecting to be joined by the chieftain of the Abundant Nigerian Renewal Party. One of the new outings for the polls in Ekiti State, that's Tunde Affair. Let us take a quick break and we'll come join our crew in Ekiti State in a moment. Stay with us.
The race for the July 14, 2018 governorship polls in Ekiti State is gathering momentum. Residents are keen to vote in who will handle the machinery of government for the next dispensation. Get the details of major happenings in the Ekiti politics, feel the clamor, the polls, the passion and intrigues. For in-depth reportage, behind the scenes and no Woodbart's insight and analysis.
If we put that for paper, we have next time they come, they say we want to say we will vote for you. The one we vote for you last time we drop our money.
Tune in to Election Watch at these times on Galaxy Television. Stay glued to Election Watch on Galaxy TV.
All right, welcome back. It's still Galaxy today. Before we take that trip to Ekiti, we'll just stay in Lagos for a bit and talk about health. And precisely, it is really a journey. First of all, you go through the whole wedding thingy, like one of our colleagues had over the weekend. Next thing, the wife becomes pregnant. There's a 9-month period, and eventually there is a baby.
A baby, yes.
So we're looking at the care of the newborn. Yes.
Babies. And of course, taking care of newborns are usually different from, they call it postnatal care. And then there's that of the antenatal, which is the prenatal. Anyway, we are not the experts in the studio. We have an expert in the studio who will be taking us through this journey. So for young mothers and probably, do I call them mothers who are preparing, mothers on the way, this is for you. We have in the house Dr. Folajimi Adebowale, a medical doctor. Good morning. Good to have you here again.
Good morning, I'm happy to be here once again.
Yes.
Thank you,
it's a pleasure.
And I'm sure people like Justin are ready to be lectured. I mean, because when they talk postnatal care, a lot of people think it's just about the mother and the baby. Maybe we should start from the papa side. I mean, as a man, what role do you play in all this?
No, aside from the fact that mostly, because I've had to play uncle for a while, and most times when
really?
there's a new baby in the house, you practically don't get to sleep.
Oh, okay. I see that is one of the scares Justin has. Okay,
Yeah,
so let's go.
he's
to
actually
the-
right. After the baby, the vigil begins. Because they have, on arrival, they have a pattern. They usually have a pattern of being awake at night and being asleep during the day. And it takes a while before they readjust to life in the exterior. But the first few things we really need to look at when it comes to care of the newborn starts from immediately after delivery.
Okay.
We expect that a baby should be put to breast as soon as possible and feeding should commence as soon as possible. And in all cases, we prefer breast milk to any other option. Any other thing comes after, or possibly if for one reason or another, mother is not lactating, then we consider other options. And breastfeeding should be done in such a way that the mother is comfortable and the baby is all comfortable also. The baby is not being suffocated. The baby can, you know, the nostrils are there, the baby is not being pressed into the breast. And mother is also sitting very comfortably, not hunching her back.
Okay.
Because you could breastfeed for a long period of time, and being in an uncomfortable position makes it difficult. And if you have difficulty breastfeeding, then there's a possibility you won't breastfeed regularly. And a newborn has to be fed like almost every 2 hours.
Okay, fine, doctor. Before we continue, you mentioned something. I don't want us to just let it slide. Difficulty breastfeeding. You know, normally when the baby is born, I know the baby cries, or when it doesn't cry, they make it cry. You know,
Yes.
after crying, and then the next time, I know the baby is usually very hungry, as well as the mom. You know, what happens automatically when the mother cannot lactate? What do you do precisely?
Well, when the mother cannot lactate immediately, we go for other options which are easily readily available. You understand? Different formulas in which we can
Immediately for the
actually.
newborn.
Yes,
formulas.
yes, because the first thing that the baby must feed,
Okay.
that is very paramount on arrival.
Okay.
And breastfeeding is, you know, the first thing we try to,
Essential.
yes. But if that doesn't work, then you have to use something, not permanently, until the mother can breastfeed.
Breastfeed,
You have to give up. You can't say because the mother can't breastfeed, you have to wait for the breast milk to come. You
Why
have
can't,
to.
what happens in the case?
Why wouldn't the mother
wouldn't the mother be
lactate?
able to lactate?
Several
naturally?
things. Sometimes some women don't lactate easily.
Health
Some,
reasons or genetic reasons?
I'll go for genetic, I'll go for more environmental. Possibly, if you have a mother who had a difficult labor or had a cesarean section and she's not fully yet awake, you might have an issue getting that woman to breastfeed.
Okay.
That's
I
a
see.
realistic case, you understand?
Okay.
You might have, so you would actually bring in for the first 1 or 2 days, that would mediate it, then you return to breast milk.
I see. Okay, so you were saying something about breastfeeding the baby comfortably, and the baby has to feed every 2 hours.
Yes.
Please continue.
Now, in that regard, the woman must, ideally, the ideal thing is that the woman must be educated by the nurse, the midwife, before discharge from the hospital on how to properly clean the nipple, how to place the nipple in the baby's mouth properly, how the baby should latch onto the nipple, how do you put your baby in a comfortable position and rest so that you can breastfeed for a prolonged period of time in a very comfortable way so that you will not be discouraged when you want to do it. So all that must be done before she leaves the hospital. Care of the cord is another big issue. People are always very particular about when the cord will fall, when the cord will not fall. There's really no problem if there's a delayed fall in the cord. The first thing we do in a hospital, you check the cord to see if it's a normal cord. Some congenital disorders will easily show up from the cord. You see, instead of 3, you see 2. You understand? So when you are sure about that, you clamp it. Then you teach the mother how to clean the cord. And they must follow that strictly. You understand? Not too hard, not too difficult. And when it falls off, they will maintain that for a while. Immediately after falling off, some babies have some slight bleeding. There's no cause for alarm.
Okay.
Then you take care of it according. Hygiene is a very key thing when it comes to the newborn, and it's where we usually have problem with women at times. Then you must realize that there are social and environmental factors involving care of the newborn, because the baby is not exactly the child of the mother. It's the child of the most experienced parent around.
Okay.
It could be the mother or mother-in-law.
Mother-in-law, yeah.
And when it comes to visiting, everybody wants to carry the baby. It's not really, you know, advisable. That's why we advise mother, get a hand sanitizer nearby. Anybody who wants to carry the baby should at least first of all sanitize their hand before they do so, because these babies are very sensitive to germs, and you mustn't allow such exposure is not encouraged.
Okay, I see. Aside of hand sanitizers and the rest, when it comes to postnatal care, okay, that you have the baby is home with you, and then, I mean, you said the video starts from there.
Yeah, the
right?
video starts from there.
Okay, so how long does that take?
It varies. It varies. Then you know the video starts in the sense that you will have to wake up at night to feed them.
Yeah.
You understand? You have to wake up at night to at least rock them back to sleep. You can't ignore a crying baby. It is not healthy for that baby, for a crying baby to be ignored. If the baby is nice, maybe 1 month. If the baby wants to just prove that he's boss here, 2 to 3 months. But within 1 month, everybody gets to acclimatize and everything
But then
changes.
again, looking at the whole scenario, specifically for the first few weeks, because they're usually very delicate, and most times you're just trying to be too careful not to hurt them, you know. Is there, I mean, I don't know, I think there should be like a proper guide, you know, because some people, they don't really have the luxury of having mothers or mothers-in-law around them to, you know, take care of their children or their babies when they deliver them. So how do you ensure that in as much as you're trying to care for the baby, you're not putting him in harm's way? Specifically, I know there's a way you have to, you know, bathe them and all of that. I just want you to address those issues.
Now, you see, most of these issues are properly addressed during the antenatal period. The mother is thoroughly lectured during the antenatal period, and the initial first day or second day stay in the hospital, the care of that baby is actually from the midwife, who will back that baby, who will take care. So there will be a demonstration of how this baby is being cared for at that point in time. There are things you find on the baby that you may find a bit unusual. Normally, newborns have a soft spot on their head, one in the front and back. We call anterior and posterior. It's normal. It is not a disease. It is not an illness. Even it's in disease conditions, it could actually lead us to pick up 1 or 2 things. If a baby is dehydrated, that soft spot will, you know, be sunken. You understand? And in certain conditions like meningitis, it will really be fuller than expected. But it's normal. It's supposed to be there for a while. So you would have this demonstration. You will have this education before you go home. It's very, very important. Do you understand? So if you don't have it in that place, it's going to be difficult for you to get it after, or to want to rely on neighbors or rely on family members to give you. There should be a standard from your primary place of care on all this information.
Okay, so you did say that it's good to get hand sanitizers for those who, I mean, the well-wishers who come around. Okay, aside of that, what other care are you supposed to give a baby? I know there's a part where they call postnatal care, immunizations and rest. When the baby leaves the hospital, going home, is the baby not immunized in any way?
No, before the baby leaves, you should actually receive the first dose of immunization.
Okay.
The first dose of immunization.
Which is?
They have it, the BCG, the hepatitis B, and there's a third one, OPV. The first OPV, the BCG, and the hepatitis involved. But you see, the primary concern of the mother is primarily the issue of hygiene of the newborn. Do you understand? If they can properly take care of the hygiene of the newborn, the bathing of the newborn, the cleaning of the umbilical stump, and also trying to keep the baby warm. Not too warm and not too hot is also an issue. A baby must be well covered. But at the same time, in very hot or humid places, you shouldn't not overexpose. You shouldn't overexpose. At the same time, you shouldn't cover too much. You wear this, you wear that, you put in a shower, you wrap everything, and everywhere is hot. Later, you realize the baby is running a fever. It's not supposed to be so. There should be a balance in good enough clothes to cover the extremities. That is the feet and the hands shouldn't be exposed. The head also should not be exposed, because they lose heat through all those places.
Okay. All right, it's Galaxy. Today we are looking at care for newborns on the show this morning. Just to remind you that it is very interactive. You can be a part of this discussion. If you have a question for Dr. Adebowale, please feel free to do so. Send us an SMS. The number will be displayed shortly, or you can also interact with us on our social media platforms using the hashtag Galaxy Today. All right, doctor, let us continue now. Most times when babies cry, how can you tell, if it's out of hunger, if it's out of exhaustion, if it's out of sickness, what? Because sometimes
discomfort.
you just cry uncontrollably, and sometimes the mothers, they're at loss for what to do.
Well, a mother must have a very good level of observation. First of all, there must be regular feeding. You don't have to wait for a baby to cry or feed. You should wake up your baby to feed the baby. Don't wait because he's sleeping now, wake him up to feed him later. No, you should wake your baby at the proper interval to feed.
How often?
I've had a new mother before, somebody who delivered very late, almost in her 40s before she delivered. And she believed a baby would eat breakfast, lunch, and dinner. And she was only trying to aim for 3 times a day. And when she really felt bad. And when she realized that she was actually way off course.
Yeah.
Wow.
You understand? So you should do that regular feeding. You shouldn't wait. Now you must also expect certain few things. For example, there's what we call colicky pain that occurs in babies. A baby feeds and cries and feeds and cries. That could be a sign of a colicky pain, and it's simple. The intestine are getting used to movement. The intestine are getting used to the food right now. Then we sometimes just let them be because it's temporary. It doesn't harm them. It will go. If you feel, oh, we need to do something, maybe some little pain relief. Now the problem we have sometimes that parents do, which is really, really bad, is when a child is leaving the hospital, they feel that there should be a box of drugs that must accompany the child home. The child is not healed. The child does not need a box of drugs to go home with. In the box of drugs, you'll see the paracetamol drop, you'll see the multivite, you'll see the nospamine and the other one for colic abdominal pain. And they start using it from the onset, which is wrong. Because this particular one, this grip water, or no, which other one? Something. If you use it for a prolonged period, it will paralyze the gut. The baby will not be able to stool. So next thing you come, they tell you the baby hasn't stooled for a whole week. And the baby's in a lot of discomfort because he's really, really constipated at that point in time. And that will lead to another set of issues if care is not taken. So we don't require, even most pediatricians will tell you, don't even use anything called nospamine or grip water, don't. But sometimes parents psychologically can't just stand a crying child. So I advocate for minimal intervention because it's not really a disease situation per se. So minimal intervention, maybe use it for 1 day, 2 days max, you stop.
Okay.
That's all you need.
All this is for a healthy baby born into this world. And
Yes.
Let's look at other complications now when you have a baby who's got some other complications. I don't know if I heard right, but I'm told that the last thing that forms in the baby is the lung.
Okay, not really the last thing that forms, but you need the baby to have a matured lung to be able to cope with life in the exterior.
Okay, so taking it from there, I mean, let me give a scenario. Now, I had a friend who had a child and they had a rare skin issue. At the end of the day, the child didn't survive. According to her, they said it's quite genetic. And so for someone like that who they said is genetic and she's like, she does not know if IVF is going to help her make selections, saying that it's a skin issue. In a situation like that where a mother gives birth and the baby comes up with some kind of rare issues, maybe skin, eyes, or some other thing. I'd like us to talk about the care.
All right. Okay, let's take it from the simple to the complex. Let's start with the simple complication that occur, which is jaundice.
Yes.
Okay. Now, like I said, jaundice let's use the word normal jaundice and abnormal jaundice. There's a normal jaundice which has certain trend. You don't expect normal jaundice on the first day of life.
Okay.
You understand? You don't expect normal jaundice to increase at a very high rate. Do you understand? A normal jaundice by itself can go away based on the procedure. But if for one reason or another the child has an abnormal jaundice, possibly the child is premature, or the child had a very difficult labor, or the child came out didn't cry on time, or there was some form of infection at that point in time at the point of delivery, this thing might spike into an abnormal jaundice, and that needs to be treated. People should recognize that yellowness of the eye should always go back to the hospital.
Yeah.
We found certain scenarios where parents really didn't know until the 7th or the 8th day when they are doing the naming ceremony. Then the relative tells them, and by then the jaundice could have been very, very bad. It could have affected the brain, leading to cerebral palsy because of the late intervention. So that issue has to be taken care of. Jaundice or yellowness of the eye in the newborn has to be carefully monitored, and it must be done so until it resolves.
Okay.
Now, when we come to other congenital issues like the ones you mentioned, you see, first of all, we have congenital issues that are not compatible with life or life in the exterior. lungs are very important. In premature children, one of the problems we have is their inability to breathe properly or inability to have continuous, spontaneous breathing, which you expect every living creature should have. So there are certain things you can't really do something about, but there are some in which once the child comes out and you notice a congenital abnormality, some may require surgery. Surgery could be as early as the third or the fourth day of life. You understand? Wow. And close observation from there are pediatric surgeons who take care of such cases, and right from birth or fourth day of life, a child could have surgery to correct such. But if not, then you have to bring in special care for such children, and the outcome is not predictable per se.
All right, Dr. Adebowale, we'll just take a bit of a pause. I understand we are getting signals now from our Ekiti station. We'll be going there to talk a little bit of politics before we'll come back to continue. On the health edition, we have a chieftain of the Abundant Nigeria Renewal Party, Tunde Affair. Good morning to you. Many thanks for joining us on Galaxy today. We're looking at the Ekiti Guild report for Saturday. So far, with all that happened yesterday, given the situation with the transporters and the rally of the APC, would you say that the state is a bit tense? Can you just bring us up to speed as regards the pulse of the state as at this moment?
Thank you very much for having me. It is not tense, actually, because I think the presence of security personnel all around town is just to ensure that there is no breakdown of law and order, which is normal. So for me, the state is peaceful, the state is not tense, and people are ready for the Saturday election. And with this, the state will be largely peaceful come Saturday by the grace of God.
Preparations and all of that by the Independent National Electoral Commission. In your opinion, would you say that all is set for the Guild report on Saturday? And looking at other issues right now, would you say the electorate has been sensitized enough on what they need to do on Saturday?
Looking at what INEC has done, I would say that INEC is set for the election because INEC has personally, I've attended some seminars put up by INEC to sensitize candidates and their followers, and then of course there have been a series of seminars also put together to sensitize voters. I'm aware also that the party agents, polling unit agents have been trained by INEC. And I'm also aware that there have been some INEC materials that have been sent to the various local governments. The non-very sensitive materials have been sent to the various local government areas of the state. So looking at all of that, I would say that INEC is ready. Perfectly ready for the Saturday election.
A fairly new political party that is obviously just happened its first outing in politics as it is now. Looking at all of that, a lot of attention is seemingly on the two major parties, the PDP and the APC. Do you think it's fair? That's on the one side. And secondly, how well do you think these new parties can fare come Saturday?
Very much. It's true that our party, the Abundant Nigeria Renewal Party, is new. We were registered December 2017, and we held our first Congress, National Congress, February 17 this year, and then State Congress followed in Ekiti State. And then we also are featuring a candidate in this election. The truth of the matter is that there are various polls that have been done. And interestingly, our party has always been in the first five. For me, that's a serious mileage. Looking at the party that just started February 17 this year, and we are already in the top five. We are already rubbing shoulders with the two giant guys. I'm talking about PDP and APC. And the truth of the matter is that at present, Ekiti people are tired of the two political parties, and they are looking for a credible alternative. And this is where ANRP comes in. The truth is that looking at our manifesto, looking at all the solutions that we have profiled to the current problems in the state, the people have seen that we are poised to take Ekiti State out of these challenges. The truth is that looking at what is on ground, our party is the credible alternative that Ekiti people have been looking for. I mean, people have gone around the state, opinion polls have been conducted, online polls have been conducted, and our party, some of these polls we came first. That's the truth. And then the worst case scenario was that we came fourth. So, and this is what has been on. If you look at that, you can give us a pass mark that our party has really gone a long way. And as things are now, don't be surprised if we come first in the Saturday election.
Many thanks for joining us on Tunde Affair, and we wish you a beautiful outing come Saturday at the Ekiti governorship polls. Our guest has been Tunde Affair, chieftain of the Abundant Nigeria Renewal Party, who was bringing us up to speed as regards preparation and, of course, the chances of his party. All right, let's flip back to health. We're still looking at care for newborn. We have questions. Let me see if I can throw some of them at our doctor this morning. This is one of the message that just came in. Good morning to you all. Please, I'd like the doctor in the house to enlighten mothers who like to use Skin Heal and other tube cream mix with shea butter as body cream on babies. Do you advise that?
Yeah, I think the most thing you can use on baby is something natural. And one of the problems I've even noticed personally is the way they anoint babies' heads with oil. It is abundant, it is excessive, and you must realize the skin has little pores inside. Okay. And this pores is where the sweat comes out from, our own glands comes out from. So if you put a too thick layer of oil, you clog sweat, you clog certain things under the skin there, and that causes to, then next thing you see is that you see rashes occurring. I don't think anything that medicated should be on the child's skin. Child's skin are delicate, are tender, and it's not as if you are curing a disease. Mixing things like Skin Heal are meant for diseased skins. The use of shea butter has been said to have benefit. I think it's natural. There's nothing toxic or chemical in it. Fair enough, but baby lotions are clearly there, which have been hygienically prepared and are quite okay. And we should just be careful about the way they put the oil.
Yeah. Another thing again is that aside from that, I notice a lot of mothers use lots of mentholatum around babies, and they use a lot of camphors around their clothing. Can you address that?
That can lead to a problem in some children who are genetically predisposed to an issue, which we call 3-GCPD deficiency. Those camphor mentholatum, and I really do not recommend it. They feel it prevents cold, in Yoruba they say otutu igbaya. The belief is that cold will just penetrate through the chest and straight into the lungs. That is not scientific. Anything that has to do with cold, we definitely have to go through a channel, which is air, which is through the nose. And the first thing about the child feeling cold or feeling warm is, did you cover the extremities, the hands and the feet, because they lose heat through those places? And do you cover up the chest? Then, there's this little issue that people occur, and that has to do with the child having some form of nasal congestion, which is catarrh, which they feel, is this. Those things are environmental in nature, in cause, not as a disease. Those things can be easily taken care of.
All right, doctor.
So the use of this silver bed and all this thing, I hope they listen. I hope they agree.
I'm sure they are.
Okay, but doctor, let's talk about the food intake of the mother now. There's also this belief that for you to lactate well, the mother has to do a lot of liquids. And I'm concerned about sugar intake now. When it comes to liquid, a lot of people feel, okay, just put the whole beverage together and take a lot of milk because you need to do something. Is you taking lots of pap? Something. I mean, is liquid the only way for?
Okay, doctor, sorry, before you answer that question, I don't know, I'm still getting more signals now from Abuja. Let's go there before we continue. Please just hold that thought. We have Dr. Emeka Moma, another medical practitioner, joining us. Good morning to you, doctor. We're looking at the care for newborns. Specifically, doctor in Lagos, he has warned against some ointments and all that most mothers or people tend to, give to their children or use on their children at such a tender age. But I want you to address something with a particular reference to some part of the country. I noticed that some mothers or grandmothers give some sort of natural herbs to young babies. Do you agree with this? Is it right in any form? Repeats the question just in case you didn't really hear. Is it wise, is it advisable for young babies or newborns to be administered with some sort of herbal concoctions? Is it advisable in any way? Because most mothers or caregivers do that.
I mean, some of us were raised where grandmothers gave us some natural herbs, and we turned out quite fine. But I believe that with the advent of modern science, it should go hand in hand. There are certain herbs that will limit growth. There are certain herbs that will limit mental development, the brain's development, and there are certain herbs that would as well cause retardation in the overall faculty of the child to develop. So I think they should go both hand in hand. It depends on what exactly the desire of the caregiver is.
Now who is to breastfeed a child. I mean, there is this notion that a woman is expected to take lots of liquid. I just want to ask your opinion on this. Also looking at one has to be careful about sugar intake. How much of liquid and what kind of liquid is expected of a lactating mother to take?
Mother and sugar intake, is that the question?
Again, I said that there is this notion that lactating mothers are expected to take lots of liquid. And there's this also belief that this liquid could be lots of beverages. Some believe in pap and the rest. And my question is, how much of this liquid is healthy for a lactating mother considering sugar intake?
It's really, really good question. Really good question. We're seeing an amazing advent of diabetes in young mothers, and it's rather alarming presently. So my recommendation will be that if you're under the care of a good care provider, you should have been screened for diabetes at a particular time during your pregnancy. If you consider to be at risk for developing diabetes, I would highly discourage you engaging in use of such beverage that often in our society we tend to say that just helps the mother with either lactation or just to make her feel better because she didn't have an appetite. There is key phrases a huge upsurge of diabetes in pregnant women, even in much younger ages. So they need to be careful as to the use of how much of this sugar products they take in. So the screen is key, basically.
Many thanks, Doctor. But one more question for you before we call it morning with you. You've talked about care for the mother, just in case she cannot lactate well, and of course mixtures that could be given to newborn. Let us look at some other issues. I don't know. I know babies have to be kept warm, and babies have to be, just get the right temperature. But most times I don't really know if it is the right thing. Whenever I visit my sisters when they have babies, they tend to always switch off all the ACs and all the fans and it's always hot. Is it the right thing? I just want you to clear that notion.
Amazing, brilliant question and excellent observation. I myself sometimes wonder when we smother this child with the blanket and the child is sweating and everyone is sweating, and then we wonder why the child is not breathing well. Basically, essentially, if this child is up to date on their immunizations and the child has been ruled out to either have a bacterial versus viral condition, this child should be allowed to breathe. Essentially mean that the child be in a well aerated environment, not necessarily put the child under an air conditioner, but there should be a fairly good amount of air circulation in that environment the child finds himself in. Most times when you cover this child up, this child will tend to have an elevated blood temperature, which sometimes can be interpreted as a fever. So a bit of common sense. If the child does not feel well, there's no need to cover the child up, which will elevate the baby's body temperature, which might give a provider the notion that this child actually has a fever. So let the child breathe, open up the windows. If you're lucky to have an air conditioner, moderate air condition to keep the air circulating. A fan is good enough, but you don't want to now create an environment where the air is very, very dense, which can invariably worsen the child's respiratory challenge.
Doctor, for clearing the air on that, we do appreciate your time. We've been speaking with Dr. Emeka Moma, a medical practitioner who joined us all the way from the Federal Capital Territory, Abuja. All right, back here in Lagos.
Lagos, yes. Okay, so I like us to also look at the food intake of the mother. He did say that what the mother is expected to take. Okay, these are parts where a lot of women want to burn fats, lose the baby fats, and they just want to get back to normal life. But for the sake of the baby, because breastfeeding is essential, and for those, because I want to look at this in two parts. Just how long you're expected to breastfeed a child if you're not doing exclusive, and then what kind of food is expected of the mother to take, saying that would your diet change because you have a new baby, or you just continue with what you've been eating?
Okay, first of all, a mother has to be well hydrated to breastfeed properly. We don't really know if this issue of using pap or using tea, I just know that that's a lot of liquid anyway. You understand? We've not done if it stimulates lactation per se, but one thing we do know is that the continuous sucking of the child stimulates lactation. So if a child starts sucking and is not bringing forth anything, do not be discouraged. Continue breastfeeding, because continually it would stimulate lactation. And you know, lactation has a lot more benefit for the mother, because as you are breastfeeding a child, another thing is that you are going through an anovulatory cycle. It's like a natural family planning.
Yeah.
Then also the uterus is contracting back to the, it's like involution back to the state it was before pregnancy. So there's a lot of benefits with breastfeeding, which every woman should not compromise with. The issue of trying to lose weight, trying to eat balanced meal, and still trying to breastfeed healthily can be well balanced, because first of all, you don't really need a special diet before and after pregnancy. A balanced diet is adequate. And if you do a balanced diet, you know, because what you eat matters, not how much exactly quantity it matters. So if you do a lot of vegetables, a lot of liquid, minimal carbohydrate, and you are active as a mother, you will lose weight. And you can still do, if you want to start working out, if you had a normal delivery and you want to start burning fat as possible, you can do your exercise and still come back and breastfeed your child.
How soon can you do that?
It depends on how quick you get off the bed and how your body recovers. I've seen women who were very active till the day they delivered, and immediately after they delivered, they were up and active again.
Okay.
You understand? The delivery was smooth, there was no cut, there was no laceration, there was no excessive hours of labor. So all those factors matter. Then also the mother should be motivated to move around as good as possible, provided the blood pressure and blood sugar issues are normal and there's no risk.
All right, doctor, we have some questions.
Continuation to breastfeeding. Okay, now for those who do, they call it formula and breastfeeding. I mean, for those who did not do exclusive, when is it right to stop breastfeeding?
Well, what we do know is that, you know, we all know the standard exclusive for 6 months straight. Now, if you I've already mixed it up earlier, then, you know, people breastfeed till a year plus, then you should continue with that duration. But we as much as possible, encourage women to practice exclusive, because the child's immunity is really, really at risk here. And overall, it's a win-win situation if you can do exclusive. Because that means your child will fall ill lesser, and development is going to work faster for the child. So I don't see any compromise. Although the problem I see with most women is like, at 3 months, their antenatal, their maternity leave is over, they need to get back to work. So for most working mothers, 3 months is the maximum they can do, unless the office allows them to have a crèche next door, where they can sneak in once in a while to breastfeed their baby.
Okay, but I also hear cases where they say breastfeeding helps against diabetes, I think, for the baby. I don't know how true that is. I mean, for future, you have a baby now who you breastfeed exclusively, is well breastfed. In later life, it looks like he has a way of avoiding diabetes.
Well, basically, later life, the onset of diabetes is multifactorial. The environment, the meal. It might be because possibly the way you feed from the onset, I'm not certain about those facts. But like I said, the benefits from breastfeeding are better not compromised with for long-term purposes for the child's development.
All right, Doctor, we have some queries from our viewers. There are lots of them. Let me just try and take 2 at a time. Good day, doctor. Is it good for a baby to first bring out the top tooth? That's one. Then secondly, this one says, I'm Yetunde from Ibadan, Molete. Please, my question is, my 2-month-old baby is having catarrh and cough, and the cough usually leads to vomiting. What do I do?
Okay, first of all, the tooth eruption, there's no significant ill disease about it. It's even been said that like about 100 or 1 in 1,000 babies, one of them will even be born with a tooth. Yeah, it's a rare occurrence, but it does occur. So it's really not a problem unless they want to attach spiritual and cultural issues to it.
Okay.
Now, normally when a child coughs for a while, they will vomit. And the vomiting is a bit scary to mothers because newborns, when they vomit, it's not just the mouth, it's both the mouth and the nose. And it's really because the whole body is not fully developed. The partition is not yet well developed. And that is the same reason why force feeding a baby is very dangerous, because it will easily go the wrong way. Because those partitions between the mouth and the breathing airway are really not clearly developed. So yes, if a child vomits continuously, it could lead to it. But you must be able to talk, is it just a viral cough, or is it just cough from possibly a bronchopneumonia situation? They shouldn't, the catarrh issue I mentioned earlier, it's basically an environmental thing. It will come, in most cases it will go, you understand?
Without medications.
Without medication. We encourage mothers to possibly even get something to suck out the mucus from the nose to enhance the breathing.
With their mouth?
Well, they used to say with their mouth a few years ago, but right now people can use little suction syringes to possibly suck it out, you understand?
Okay, good morning to you all. What is the cause of bulged navel in some babies, or can it be genetic?
Okay, the bulging navel is, okay, we must understand that there's a wall in the abdomen. There's a wall of, a structural wall. And that wall has a little defect around the navel area, because the navel was what the baby was using in the womb to feed. Now, for certain reasons after, this hole might be a bit bigger, a bit smaller. Over time, it's corrected. Loops of intestine from behind the wall find their way through that wall on the outside. That is why you find some people having bulging navel, and when they lie down, it's like it's gone. And in some cases, it becomes an issue because a loop of bowel can get into that hole and get stuck in that hole. And that might require medical intervention for it to be loose. But in most cases, it really doesn't happen. So the wall is there, it's from the umbilicus, and the loop of bowel can escape through it. But over time, as a child grows, this thing gets smaller. If it doesn't get smaller, there could be a little surgical intervention to close up the hole.
All right, more questions. This one says, okay, my 2-month-old baby poo is So it's stretchy and looks more like a mucus and no more blood stains. I don't understand. What do I do? And the second one is, please, my name is Print. Is it good to add sugar in a pap for a baby every day?
Okay, the issue about the poop of a baby matters all the time because you really shouldn't see mucus in it. That means that the child is having some colicky abdomen and mucus is being shed. The color could vary based on what the child is eating, based on such issues. But the number of times the stool too should be observed. So it's really not, there should be a pattern you should see. And that pattern shouldn't change for reasons you can't explain. Then the other question had to do with
adding sugar to pap for babies.
Well, the babies, I really don't know people use sugar. I know people use glucose.
Okay.
Then the pap should be, by what I'll say, you do exclusive, after exclusive. The fact is, if you don't put that pap, will that child even take it? Let's start with that.
Okay.
If you don't sweeten it of salt, will the child even take it?
Yeah.
There's no harm in using glucose. Sugar, fair, but you must keep it balanced because I don't see where you give a child, I don't see where you give a child pap without something sweetened and the child will accept it. You will have a warfare to deal with every time they are feeding.
Okay,
So the little sugar won't lead to diabetes for the newborn.
Can we look more into the postnatal care? What kind of immunizations the child is supposed to have, and at what stages are they supposed to have these immunizations?
Okay, what I usually go by with are the basic national schedule. We start with 4 weeks, 4-week interval. There's a schedule which is mapped out by the nursing care, which I should advocate parents should strictly adhere to. They should have a card when they start doing it, and even if they change locations, they should go to the nearest health center and continue from there. However, there are also some little other special immunizations which you find more in private hospitals, which if affordable to you, you should go for if you can afford it. But if you can't afford it, I believe the basic one being provided by the National Health Scheme, by the Federal Ministry of Health, should cover you adequately.
Okay,
For me and my children, I only went for the basic. I really didn't go for anything beyond the basics.
Okay.
Okay, doctor, one final question so we can go. This one is asking umbilical hernias in infancy, how can it be addressed?
You know, that has to do with the issue we discussed earlier, the loop of well coming out through the hole in the wall. That is what we call umbilical hernia. And it becomes a problem, like I mentioned, when a loop of well gets into that hole and doesn't go back, because you expect it to keep making that motion to and fro. If it doesn't get stuck, the child will be in serious pain, and that is a medical emergency. And that's a big result. What I do advise people that immediately if they notice that it doesn't go down, we usually try to get something cold, like a cold compress, to place on it. If it's cold, if it's colder, because inflammation and warmth makes it swell. If it's colder, there's a possibility it might reduce and get back in. But they shouldn't just do that and leave it there. Once they get a cold compress, maybe a cold ice on that platform, they should be on their way to the hospital because it's not in all cases that the cold compress will work.
Okay, so before we let you go, just tell us the basic things we need to do for postnatal care.
First of all, the mother should be very, very keen on hygiene. You cannot go wrong with that factor. You should try and make sure that anybody carrying that child should do so with sanitized hands. They should please do not switch off the AC because of the child. They should wrap the child up properly so that child is not too hot and not too cold. They should balance that temperature out because we don't want the child sweating profusely. That might lead to dehydration. The feeding should be regular. The cleaning of the umbilical cord should be very regular also.
When you say regular, how regular do you
The feeding is ideally 2 hours or 3 hours.
Okay, and the cleaning of the umbilical?
The cleaning, depending. Some people say you clean in the morning, you clean in the afternoon, and clean in the night. Just regular cleaning until it falls off after. Then you will, for a duration of time, then you put an end to it. Then what else? Then the use of medication for the newborn should be only on a need basis. There's no need for multivitamins per se. There's no need for paracetamol routinely. There's no need for using Gripota and Ospamine routinely. It should only be when it's needed. You understand? So we stick to those things. But if you stick to those things, you get fantastic results. And as much as possible, practice exclusive.
Last practice exclusive, and somebody is asking that she did 3 months exclusivity because of work, and she's back at work. And so how can she make up for the remaining 3 months and ensure that the baby's immunity is
at that point in time, we have to bring in things where the government would help us with laws that would promote paternity and maternity leave extended. In some countries in Europe, paternity and maternity combined, for the first 12 years of that child, somebody's always around.
So I can go for paternity.
Oh, like seriously,
Yes.
Justin?
You can. Yes, you should.
Please, what's the role of the
should.
father in all this? I mean, we've spoken about the mother. How do they come in here?
Okay, the role of the father is this. It's not all the time the mother can get up to carry the child or rock the child, especially at night.
Justin.
We've had cases where after delivery, the stress was so much on the mother, you even have to admit the mother. Again, even apart from postpartum depression, the stress, the inability to sleep properly will weaken her immune system. Possibly she even had high blood pressure during pregnancy.
Wow.
She's coping with that also. So it's a lot of stress, and she needs a man beside her to support her.
Justin, I hope
so
you've
long as
taken
we get
notes.
to go for paternity leave, no problems, because I won't wake up at 2 a.m. and rock and care for my baby, and I'll be rushing back to the office at 7. So, one for the day for paternity leave for all new fathers in Lagos and beyond. I champion that. That's our show for today, and many thanks for being a part of it. I want to say thank you to all of you who have sent in them comments. My name is Justin Academy.
And of course, a very big thanks to Dr. Folajimi Adebowale, medical doctor right here in Lagos. Thank you so much.
It's a pleasure.
And all the way from Abuja, we had Dr. Emeka Boma, a medical practitioner. I want to say big thanks. And of course, Tunde Afe, chieftain of Abundant Nigeria Renewal Party, all the way from Ekiti State. Thank you all for joining us. We'll do tomorrow, we'll do the same. But we'll be looking at lifestyle. I'm Uchi Onyekoji. Bye for now.
The race for the July